My name is Robert Bache, Medicare Bob, and I own Senior Healthcare Direct, and I empower people with Medicare knowledge. In this video, I'm going to review the warning signs of heart disease. Medicare has preventative services that will allow you to prevent and treat any heart disease that you might have. So it's very important that you know the warning symptoms and warning signs to heart disease so you can utilize your Medicare to help keep you as healthy as possible. The first warning sign for heart disease is sleep apnea. When your snoring is broken up by pauses in your breathing, your brain may not be getting enough oxygen. It will send signals to your blood vessels and heart to work harder to keep blood flowing going. This raises your risk for high blood pressure, abnormal heart rhythms, strokes, and heart failure. Fortunately, sleep apnea is treatable. If you have Medicare, you can get tested for sleep apnea. If you have Medicare and a Medicare supplement plan, your test will be covered 100%, and any treatment, like a sleep apnea machine, will be treated as DME, durable medical equipment, and Medicare will pay 80%, and your supplement will pay the remaining 20%. Another warning sign is a yellow or orange bumpy rash. Extremely high triglyceride levels can make your skin break out around the knuckles of your fingers and toes and on your bottom. A lot of these fats in your blood may play a role in hardening your arteries, and high numbers are often related to other conditions that put you at risk for heart disease and strokes too. So again, it's important that you use your Medicare for your preventative annual visit to go get tested and diagnosed and treated for any heart disease. So if you have this rash, go see your doctor immediately. Another warning sign is poor grip strength. The strength of your hand may tell you something about the strength of your heart. Research suggests the ability to squeeze something well means a lower risk of heart disease. If it's hard for you to grasp an object, odds are higher that you have or could develop problems. But improving your grip strength alone won't necessarily make your heart healthier. This is why when you go to the doctor, one of the first things they do is ask you to squeeze their hands because they want to test your grip. As I just mentioned, a poor grip is an indication that you might have heart disease. Another warning sign is dark spots under your fingernails. If you haven't banged or hurt your finger or toe recently, little dots of blood trapped under your nail could point to an infection in the lining of your heart or valves, called endocarditis. You can also get these blood specks when you have diabetes, and people with that condition are 2 to 4 times more likely to have heart disease and strokes. If you have diabetes, you already know that you're at a higher risk for heart disease and stroke. But if you do not have diabetes and you see these dark pellets under your fingernails and you haven't banged it recently, that's a warning symptom that you could possibly have heart disease. Another warning symptom of heart disease is dizziness. Lightheadedness is often a direct result of something wrong with your heart because it isn't pumping enough blood to your brain. Dizziness could be a symptom of an abnormal rhythm called arrhythmia. Heart failure, meaning the weakening of the muscle, can also make you unsteady. Feeling woozy is one of the many and less known symptoms of a heart attack too. So make sure if you've been, don't just, if you get up and think, oh, I got up too fast so I'm dizzy, and that's something normal to you. It's not normal. So that could be an indication you have heart disease, and the better you treat heart disease and the faster you treat heart disease, the better off you are and staying healthier longer. Another warning sign is bleeding gums. Experts don't totally understand the link between gum disease and heart disease, but studies suggest that bleeding, swollen or tender gums may lead to trouble with your ticker. One theory is that bacteria from your gums gets into your bloodstream and sets off inflammation in your heart. Having gum disease, which can lead to tooth loss, may also raise your chances of a stroke. So if you have excess bleeding every time you brush your teeth, make sure you bring that up to your doctor because that could be an indication of heart disease. Another warning sign is dark, velvety skin patches. You may find these thick spots and in the skin folds and increases such as your neck, armpits, and groin when your body has trouble using the hormone insulin. The patches could have skin tags too. If you aren't being treated for insulin resistance, metabolic syndrome, or type 2 diabetes, see your doctor for help controlling your blood sugar and protecting your heart. So if you get those thick spots around on those armpits or thigh area, make sure, or even your neck, make sure you go tell your doctor about it and you get checked out for heart disease because that's a symptom. Another one is trouble breathing, okay? Feeling shortness of breath can be a symptom of heart failure, an abnormal heart rhythm, or heart attack. Tell your doctor if you struggle to catch your breath after doing things that used to be easy for you, or if it's hard to breathe while you're laying down. Have chest pain? Make sure you call 911. Another heart disease symptom is swelling in your lower legs. It happens when you stand or sit for a long time, and it also is common during pregnancy. But for people over 60, if you're sitting or standing for a long time, and fluid buildup can also stem from heart failure and poor circulation in your legs. Swollen legs could be from a clot that's blocking the return of blood from your lower limbs to your heart. Call your doctor right away if swelling comes on suddenly. I've actually had clients that this has happened to. They'll be sitting down on a plane. They get off the plane and they realize that something's there's swelling in their lower ankle and lower legs. That is not good, okay? That is actually a really common indication that something's wrong with your heart because the return blood is not getting back to your heart. So it's pumping down to your extremities, but it's not coming back. So if you have swelling in your lower legs, go see a doctor immediately. That could be an indication of heart disease. The last one I'm gonna talk about is fatigue. Now, as we get older, we might get more tired, but don't always chalk it up to poor sleep. Heart failure can leave you tired and drained because the muscle no longer pumps well enough to meet your body's needs. Watch for other symptoms such as coughing and swelling. Since feeling wiped out and weak can be a warning sign of many conditions, including anemia, cancer, or even depression. Even if you're feeling a little more tired, you just don't just chalk it up to you did too much yesterday. Really kind of know yourself, pace yourself. But if you know that you're tired and you are getting what's the new normal of sleep, because I understand as we get older we don't sleep how we used to, but don't just chalk it up to being tired. If you have not been diagnosed with sleep apnea or another sleep condition and you are fatigued, in the mid-afternoon, that could also be an indication that your heart's working too hard and that's what's making you tired, which is an indication that there could be blockage or artery issues. So make sure that you go to your doctor because that could be an indication of heart disease. This is a Wellness Wednesday video. So the main point of this video is to go over the symptoms of heart disease with you and let you know how Medicare can help you. All of heart disease symptoms can be diagnosed by doctors. So make sure that you go to your doctor. Every year you get a free wellness exam from Medicare. So when you call to make your appointment, it's free. So you can call them and say, listen, I want to schedule my wellness video, or my wellness visit to Medicare for my annual physical. You should have no out-of-pocket cost for that, even if you just have Medicare. Now, if you have Medicare and a Medicare supplement, then and you go to the doctor, it's going to be covered. If you have the Plan G, which I recommend, and you have that small $183 deductible, once you pay that, every diagnostic test that your doctor orders to treat, or any treatment that they order for heart disease will be covered by Medicare 80% and your supplement by 20%. So heart disease is treatable. Make sure you go see your doctor if you have any of these symptoms.